My name is Amalia and I'm studying medicine at the University of Melbourne. I'm in my third year. I chose to study medicine for a few different reasons. I did some anatomy classes in undergraduate and I absolutely loved it. Another element of my decision was also because of the family connection that I have. My grandpa studied here at the Melbourne Medical School.
My name's Kermond. I studied medicine from 1953 to 59 when I graduated. I wanted to do medicine because I was always interested in how people's body worked and why they got sick. I was really interested to know why, and that's why I took on medicine.
I think my grandfather's career did inspire me to study medicine. It's something that I wasn't conscious of for a long time, but I think growing up in that environment, seeing how much joy he got out of his career, he was never bored. He was always enjoying what he was doing. And even after retiring, he stays in touch with a lot of people that he met through medical practice and stays connected to the field.
It's an interesting career. It interested me when I was a student. It interested me when somebody had walked through the door when I was practicing and I had to figure out what was wrong with them. If you see somebody with a problem, you're motivated to find out what it is, see if it's fixable, and then hopefully fix it.
I think I wasn't conscious of that influence when I was younger, but seeing the joy that he got out of clinical practice for so long definitely influenced my decision. I think he really wanted me to study medicine as well, although he didn't say it out loud, but he tried to kind of gently expose me to the world of what he was doing in terms of seeing patients and clinical decision making, like sharing stories with us. It was kind of implicit that he thought that it would be a good fit for me, and I kind of became aware of that later when I did try it out for myself, that it was a great fit, so he was right.
Well, I'm very proud of her. She will find studying medicine interesting. I don't know whether she wanted to follow in my footsteps, but she was clever. She was always interested in things which you need to be to study medicine.
Every day you just kind of have to rock up to the hospital and think like, what do I want to learn today? What can I get someone to teach me today? Or like, what can I go and talk to a patient about and find out about their experience?
Actually, when I was at medical school, I think there were only about 3 or maybe 4 women doing medicine, and it were 100 fellows. And I think that's different now. I imagine it's 50-50. The camaraderie of the fellows and women that I studied with. You know, it wasn't easy, so we'd get together over textbooks or Gray's Anatomy and go through things together. So it was easier to study with somebody than by yourself, which was a bit lonely. The camaraderie was very important.
Grandpa always asks me after every rotation, like, so what do you think you're going to do? I think he's hoping that I will say radiology, but I'm not sure if it's my cup of tea, but I really, really love working in neonatology and paediatrics. I think it's a real privilege, especially in the neonatology environment, to be a part of that family's journey. Some advice that my grandfather has shared with me about my medical career is that he enjoyed every aspect of his career. It does actually mean a great deal to me personally to be continuing a family legacy, and I know that he's really, really proud of me, and that means a lot to me as well.